Hello, everyone. Let's talk about the core surgical skill today. This is not a teaching video. It's basically, I'm here to tell you that, what are the modules or what are the topics which you can expect in this module. Core surgical skills, they are basically the vivas, right? So these come as viva stations mostly, and role players are very less. Role play stations are like consent station that you need to talk about some surgery, and then you are taking the consent from the patient. Okay, you're explaining the procedure, you're explaining the risk versus benefits of the procedure, you are telling the alternative procedures and no procedure to her. So these are the few modules which you have to tackle in core surgical skills, right? And so what are the topics that you can expect? So moving ahead, yes, just give me a minute. Yes. So here, the common stations which can come are OT list. There will be an OT list having like 4 to 5 patients, and you have to prioritize them according to the urgency or emergency of the situation. Okay, if some emergency come like ruptured ectopic or something, then you will put that in at number one. That will be on the day only, right? That you're about to start your OT, but meanwhile this you have got a call from the ER that the patient is bleeding and have vitals are unstable. Then you are going to make the diagnosis according to the investigation reports and the vitals of the patient and the examination and the ultrasound findings, and then you are going to prioritize or re-revise the OT list. That can also be possible. Okay, then coming on to the electrosurgery, this is the whole lot viva station. Instruments will be shown to you, energy sources will be shown to you. You have to identify them, and just identify and speak the principles how they work. Okay, no need to go into more much of the details, just you need to know what kind of source it is and what is the principle on which it works and where it can be utilized. Coming on to the consent stations, in the consent they are very important station. They are the SPTs also, they are the vivas also, right? So you need to know the basic consent forms of common procedures, right? So in teaching also consent comes. So consent has three this thing dimensions of covering the topic, as an SPT, as the SD, and as the teaching station. And then knot tying, you must be very expert before going to the exam in knot tying. I will be sending the videos in the group about the knot tying. That's in these are the YouTube videos only. Uh, and just practice that on your own, and then only you can teach. Operation sheet is there. Then episiotomy repair again has two parts. In teaching, number one will be the simple epi repair, teaching how you put the episiotomy, right? So that is the simpler station. Then comes the OSAT, that some of the ST1 will come and or ST2 will come, and they will ask you to sign the OSAT for them. So that will be the trick. Here you have to explain to the ST one or two that what are your limitations for the OSATs, what kind of OSAT it is, right? And that will be a viva on the OSAT. So these two stations can come up. Though OSAT station can come in anything, like for the knot tying also. Coming on to the pre-op rounds, this is a big structural discussion station and a bit of tricky also, because you can't prepare too much for this. You just have to go along the flow, like whatever situation has been given to you, and it is not necessary that you'll be given the same situation which has been given in the last time. So here you will be seeing the patients as like who have been admitted already in the pre-op room, and here you have to check the diagnosis again. You have to confirm the indication again, like whether she still has the indication for the surgery. And then, you know, are there any risk factors? And we need to take any risk reduction measures, right? So these are the patient safety. Basically, in pre-op round, you are mainly assessed for the patient safety and for your applied knowledge. Okay, so these two modules are the main modules, so you need to focus on them rather than going on the same line of speaking. Just focus yourself on the safety points and the clinical knowledge you have regarding the procedure, and you have to speak some of the buzzwords like consent, WHO safety check, and then coming on to the enhanced recovery program. This is a leaflet, and you need to be thorough with that because a complete viva can come regarding this. Coming on to the gynae ward post-op rounds, like patients, first there can be pre-op rounds, then there can be gynae ward rounds. Both are the different scenarios. In them post-op rounds, surgery has already been done. Now you're going to examining the patients, how patients are doing post-operatively. So mainly you have to focus upon the oliguria or anuria, vitals of the patients, and any this oxygen saturation, any breathlessness, to rule out the complications mainly happening in the post-op, that's preeclampsia. You need to found not preeclampsia, I'm so sorry, this is pulmonary embolism. Right, pulmonary embolism, you need to see the bleeding post-operatively, right? So these are the main points which you have to see. Then any intraoperative complication if it has happened, so that you need to carefully watch after the surgery. And if anything that has happened intraoperatively, um, the incident reporting thing you need to know, and risk management things. So the debriefing of the patient wherever required, what if something new has been found during the operation theater, during the operation, that you need to debrief to the patient post operatively. Now coming on to the details of uh, the topics in them, like for the consents, I told you that consent stations are important stations. These are the viva stations, right? Teaching also, both of the things can happen. um, Hysterectomy consent is very, very important. You need to be thorough with the common, uncommon, and rare risks, right? So you should be very well aware. And apart from that, cesarean section. Cesarean section is very important. So cesarean section comes on as a whole as well, right? Like the consent will be for the cesarean section, and that's the commonest procedure. We know that, right? So you should be very much thorough with the consents. Okay, read the consent advice for the hysterectomy, for the abdominal and vaginal both, for the cesarean section. That is very important. Then laparoscopy consent advice also you need to know, lapro and hystero, as these are the main mode of surgeries nowadays, minimal access surgery. You should know the risk and benefits, alternative procedures and no procedures, surgical miscarriage consent advice you need to be thorough with, and sterilization. Then coming on to cesarean for placenta previa and decreta, what else you are going to add other than the cesarean consent? Coming on to the vaginal delivery consent, operative vaginal delivery, forceps and vacuum, verbal consent is required. So you need to be thorough with that. If there are any tears and you're going to take her to OT, so those additional points also you need to know. CVS and MNI on your guideline is there. You can go through that once. Then what are the procedures on which viva can happen? Cesarean section is the commonest one. So here the focus will be on indications, like what are the indications of cesarean section? Just give me a minute. Okay. So cesarean section will be like what are the indications of the section? Okay. And yeah. What are the principles of the cesarean section? Whether this for this patient, if some scenario has been given to you, so can you go for the cesarean section for her? And how will you do it? What is the procedure, principal procedure, right? What are the risks associated with them and what are the benefits associated with the cesarean section? Similarly, in the hysterectomy, this is the commonest station again. Hysterectomy, so many instruments will be given to you. There will be instrument viva also and the principal procedure, risk, benefit viva also. Myomectomy, you need to know how to do it. And minimal access surgery, yes. These are the important ones, very, very important ones. This minimal access surgery viva. Obstetric anal sphincter injury repair, it can come as a teaching also and as a structural discussion also. Then coming on to the instruments, it is altogether a very important thing. I'm taking a class on Friday, like this 27th of September at 10 a.m. GMT. That means 3:30 p.m. Indian Standard Times. So you all should join that. Then this Viva I've already told you. Then vacuum aspiration, surgical management of miscarriage procedure can be asked in detail from you. Cystoscopy, you just should be knowing the procedure. That's all. So patient safety points, what are the safety points that you should be taking care of in the surgical module? This is the consent, this is the WHO safety check, moving and positioning of the unconscious and recovering patient, knowledge about risk management, that you should be knowing. That is incident reporting and colleague feedback sessions. Thank you.